Codeine, an opioid used in pain management and occasionally for cough suppression, however has highly varied clinical effects due to it being a prodrug. As a prodrug, codeine requires hepatic bioactivation via the CYP2D6 enzyme, where it is converted to the active morphine. From there, the therapeutic effects can be exerted. While only 5 to 10% of the codeine administered is converted to the active morphine, and 80% excreted unchanged, this bioactivation process is nonetheless significant in determining clinical response. CYP2D6 is a highly polymorphic enzyme with over 80 alleles, leading to the largely deviated enzyme activity, and the individual patient's codeine metabolic phenotype is determined by the diplotype, which involves a combination of two alleles. Common examples include allele number 1 and 2, reflecting normal function, 9 and 10 reflecting reduced function, and 3, 4 that have no function. This will be further translated into enzyme activity scores. In clinical settings, the activity scores classify patients into 4 broad phenotypes: poor, intermediate, normal, and ultra-rapid metabolizers. For example, those with activity score 0, such as diplotype STAR3/STAR4, indicates a poor metabolizer, whereas higher enzyme activity greater than 2.25, such as STAR1 with 2 copies, reflects a ultra-rapid phenotype, and so on. In general, higher enzyme activity scores result in more codeine being converted into active morphine, whereas decreased or no activity results in minimum morphine formation. Followed by a standard dose of codeine, these variations precipitate the risk of toxicity from excess morphine or therapeutic failure from inadequate morphine conversion. An example is when codeine is used for analgesics. Higher CYP2D6 activity in ultra-rapid metabolizers have rapid conversion to morphine, resulting in higher systemic exposure. This can potentiate opioid toxicity, which can present as profound sedation and life-threatening respiratory depression. In contrast, poor metabolizers may receive little to no pain control due to minimal morphine being formed. This can lead to unnecessary dose escalation or additional analgesics. From this comparison, we can see that the standardized codeine dosing across a diverse population is not reliable, due to the lack of predictability of gene-related pharmacokinetics. Pharmacogenetics testing can incur a notable upfront cost and is not currently covered by Medicare in Tasmania. As a result, it is not routinely performed and requires case-by-case consideration. Despite this, conducting the tests can be beneficial in high-risk or more opioid-sensitive patients, including pregnant, pediatric, and those with a relevant family history of altered codeine response. For example, in children who have just undergone tonsillectomy and were identified as ultra-rapid metabolizers, codeine should be avoided to prevent the risk of respiratory depression and coma. Overall testing in these cohorts may improve therapeutic efficacy by reducing the trial and error time or cost, and more importantly, preventing the potential harm. Certain external factors can alter the enzyme functions from the predicted baseline genotypes, namely the physiological changes and enzyme inhibitions from CYP drug interactions. This phenomenon is referred as phenoconversion. Physiological changes throughout a person's life can influence enzyme activity. For example, neonates tend to have lower CYP2D6 activity, which gradually approaches adult level around the age of 1. In elderly patients, hepatic blood flow may be reduced, especially in those with liver impairment. This again leads to reduced metabolic activity and conversion of codeine to morphine. Drug interactions being the other factor are commonly seen if a CYP2D6 inhibitor drug is used alongside codeine. Some clinically common examples are the SSRI antidepressants, paroxetine and fluoxetine. These agents can block the CYP2D6 enzyme activity, effectively turning a normal metabolizer into a poor metabolizer, causing them to receive diminished analgesic effects. Finally, codeine safety and efficacy are highly dependent on an individual's CYP2D6 activity, so be sure to consider if a personalized regimen is necessary, especially for patients at higher risk.